Good afternoon and welcome to the 101st COVID update for the town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator, and want to thank you for joining us today. We are returning to updates during the month of August 2021 due to some of the recent changes that we wish to communicate to the Plymouth community. Today I'm joined by a panel that includes State Representative Matthew Muratore, Plymouth Board of Health Chair, Dr. Barry Potvin, and Plymouth Superintendent of Public Schools, Dr. Christopher Campbell. We'll be bringing this presentation to you throughout the month of August in order to provide information. One announcement that I did want to make today is that currently at the town hall, there is in-person absentee voting. We are recording this on August 4th, and the election is a week from Saturday. Absentee voting will be for voters that will be out of town on election day or physically unable to go to the polls. The governor signed an extension for mail-out early voting, and if someone wishes to get an application, they need to get it into the clerk as soon as possible. You can go to the Town of Plymouth clerk's webpage in order to get that, since the deadline for a mail-out ballot will be August 9th at 5 p.m. And at this time, we're going to begin today with Dr. Barry Potvin. He is Professor Emeritus at Yeshiva University, Department of Biology. Welcome, Barry.
Thank you, Steve. I'm going to start off by doing screen share as quickly as I can. Is that visible? Can everyone see that?
I'm not seeing it, Barry.
Okay, let me try something else.
And while Barry Potvin is screen sharing, I want everybody to know that you can, if you join us late, you can find this show and others at pactv.org Plymouth and click onto the TV schedule, bring up the full schedule. And Barry, now we have the screen share. Thank you.
Okay, good, thank you. So I'm going to give you some information. I'll do it as quickly as I can. I'm going to run through some of these rather quickly. You probably are used to seeing this from previous shows before we stop them. If you look down at the very bottom, you see the current data from the state, and it shows 59 daily positive cases per 100,000 population, giving us a 6.7 value and a positive test rate of 2.48. This is the graph that we usually were showing you, and you can see over on the far side, there has been a slight uptick. The reason why we're starting these again is because of this. The Delta variant is causing a lot of changes. And I'm going to go through those a little more carefully. It's currently causing at least 83% of the cases in the US. It's at least 100% more transmissible than the old variant, which was previously known as UK, but now Alpha. Reason we're concerned about this is variants arise by random mutations as the virus replicates in infected individuals. The more people that are infected, the more variants will become present. Fully vaccinated individuals are protected against serious illness, hospitalization, and possible death, but they do exhibit milder symptoms, and they can apparently still infect others, as we just found out from Provincetown. In the United States, 99.9% of currently hospitalized COVID patients are unvaccinated. In Massachusetts, that number is 99.992%. Nationwide, 40% of COVID hospitalizations involving the 18 to 49 age groups. They have a lower vaccination rate, and a lot of these cases are in Florida and Texas especially, but also Louisiana and Alabama. CDC now states that everyone, regardless of vaccination status, is strongly advised to continue wearing face masks indoors, and that means covering both your nose and your mouth when in crowded conditions, and to also try to maintain physical distancing. Other information about this, why is this happening? they found that there's large numbers of virus particles present in the nasal passages and throats of infected individuals, even among those who are fully vaccinated. This allows the infection to be spread to others by coughing and sneezing, singing, or anything that involves a lot of exhaling. Each Delta infected person on average is now thought to be able to infect 5 others, whereas the old Alpha variant, it was 2 others. We already talked about that. Full vaccination with Pfizer and Moderna provides excellent protection. And it's now thought we need at least 90 to 95% of the population that's eligible to be fully vaccinated to finally stop the spread of this new variant. In the US, that number is now 49.7%. In Massachusetts, it's 65.9%, and in Plymouth, it's 58%. A lot of this happened because of what happened in Provincetown. Like Provincetown, Plymouth is a tourist destination. There's substantial risk of transmission in Plymouth at the moment, and there's a high risk of transmission in Barnstable County, and especially out in Provincetown. Provincetown was considering capacity limits. They put in place an indoor mask advisory or mandate. The way they decided that was that if the positivity test rate was above 1%, it would be an advisory. And if it fell below 1% for 5 days, it would be lifted. And if it was above 3%, it becomes a mandate. Plymouth's positive test rate is now 2.48, and it seems to be going up somewhat. So this is state data. I'm not going to go through this in great detail, but you can see that for the fully vaccinated, it does show 63.9% of our total population in Massachusetts are fully vaccinated. And if you just look at the 18 and over population, it's 74.5. This was a community level transmission chart from 28th of July. And if you look real carefully up here where Plymouth County is, you'll see that it was labeled orange, which is substantial transmission. The most recent data that came out on August 3rd is this. It shows hotspots, and you notice that there's a lot of counties now in Massachusetts that are either high risk, which is Barnstable and Nantucket, or substantial risk, which is Middlesex, Suffolk, Bristol, Plymouth, Essex, Worcester, and Hampton counties. This graph just shows you the daily trends in the number of cases in Massachusetts being reported to the CDC. And you can see again, if you count, this is the first peak. This one was huge in early this year as the second peak, another one sort of in late spring, and now we seem to be edging up again. You can also see that in a different form here, but it's basically the same thing. These are the data that just came out as of yesterday at 1:19 p.m. In the US, there was 35 million and more than 35 million cases, which is 10.6% of the population, and 611,791 deaths. In Massachusetts, 721,885, which is 10.5% of the population, 18,084 deaths. Town of Plymouth, 5,332 cases and 151 deaths. The deaths, fortunately, in Plymouth have not budged for many, many weeks. So what are we going to do about this? This is the last slide I'll show you because I want to leave time for the other members of the panel. These are things the Board of Health discussed at our last meeting last Wednesday. We discussed whether fall town meeting should or must continue to be virtual by remote access only. And the Board of Health decided for the moment to just leave it as should be virtual as it has been in the past. That was voted unanimously by the Board of Health. We discussed whether or not face masks are required for entry into town hall and other municipal buildings for everyone, regardless of vaccination status. And we decided to table that for our next meeting, which will be coming up a week from Wednesday. We unanimously passed a face mask advisory that states that everyone, regardless of vaccination status, should resume wearing face masks covering both the mouth and nose when in indoor locations around others who may or may not be vaccinated, such as bars, nightclubs, grocery stores, concerts, movies, sporting events, other gatherings, It applies to restaurants too, but of course you can't wear a face mask when you're eating and drinking. So that we passed. We then discussed a travel advisory where everyone should get a COVID test within 5 days after returning from any location with a lower vaccination rate than where you currently live or in areas designated by the CDCs as having a higher potential risk of transmission. That was tabled for our next meeting. And the way these things have been determined to be categorized is that positive cases over 7 days, if it's more than 100 per 100,000 population, it's high transmission risk. If it's 50 or more, 50 to 99 per 100,000 population, it's substantial. And if it's less than 50 per 100,000 population, it's moderate or low. At the moment, Plymouth County is 76.9 per 100,000 population. So it's substantial, and so is the town of Plymouth. I'm going to stop there, and there won't be any questions today, but I want to leave time for everybody else to say what's going on with their data and their plans for school reopening, especially, and for Matt to tell us more about what's going on at the state level. Thank you.
Thank you, Barry. And actually, I do have questions for you if there is time permitting, but at this time, we're going to leave Dr. Barry Potvin, who is chair of the Plymouth Board of Health, and we're going to go to Dr. Christopher Campbell. He is the superintendent for the Plymouth Public Schools. Chris, welcome. And I know that people are beginning to already look to plan for the opening of schools. Tell us what you're thinking about.
Yes, we are. And, you know, we're still, we've learned from last summer, information evolved over the course of August, especially. So I'll get into that, but we're sort of taking it as a wait and see approach, but let me get into that. But thanks for having me, Steve. First, I wanted to talk briefly about some additional funding that's coming our way and how the community can support our schools. So the American Rescue Plan was enacted in March, and it provides additional funds for our school districts to respond to COVID pandemic issues. But in order to receive those funds, the district must consult with varied stakeholders from across the community to help best determine how we prioritize those funds. So we'll be sending out an invitation to the community to get feedback, and we're asking people to provide input regarding how we could prioritize those through a very brief survey. So this will go out, push through email, our social media accounts, as well as be on our main page for our district website. So I just wanted to say a word about that and encourage people to participate in that survey. If they have any questions, they can contact my office or any one of my administrators in my team. Last Friday, regarding our return to school, I had a call with the commissioner of the Department of Elementary and Secondary Education, where the commissioner shared the latest joint fall guidance that was published collaboratively by the Department of Ed and the Department of Public Health. So I want to walk through a few of the items that were mentioned in this initial guidance. So this fall, as of now, DESE, as they're known, and the Department of Public Health strongly recommend that all students in kindergarten through grade 6 wear masks when indoors, except when students, except for students who cannot due to medical conditions or behavioral needs, much like was the case this year. Masks are not necessary outdoors and may be removed while eating indoors. Department of Ed and DPH are also strongly recommending that unvaccinated staff in all grades, unvaccinated students grade 7 and above, and unvaccinated visitors wear masks indoors, again, in alignment with statewide advisories on masking. They're also recommending that schools allow vaccinated students to remain unmasked. So this is something that is varying, I think, from community to community right now. Any individual at a higher risk for severe disease from COVID or with a household member who is high risk is encouraged to mask regardless of vaccination status. Again, consistent with updated DPH guidance. Any child or family who prefers to mask at school should be supported by this choice. By federal public health order, so this is a federal public health order, all students and staff are required to wear masks on school buses at this time. And all staff and students must wear masks while in school health offices, and we should be receiving additional guidance for school health professionals forthcoming from the DPH in the near future. There are currently no physical distancing restrictions put in place by the Department of Education, and all schools must open 5 days a week. And the Department of Education notes that the physical distancing really put restrictions on districts' ability to have students attend 5 days a week full-time due to those physical constraints. You may recall that districts found themselves last year quarantining a number of students. The protocols were very strict. According to the commissioner last week, districts will see some relief on this quarantine guidance. So the Department of Ed and Public Health will be releasing a new version of their protocols for responding to COVID situations. Part of this guidance, districts in a statewide testing program or using other diagnostic tests will be able to implement what they're calling a test and stay protocol in lieu of requiring asymptomatic close contacts to quarantine. So under this new situation, close contacts will have the option to remain in school and be tested daily with what's known as a Binex Now for at least 5 days. And vaccinated staff and students are exempt from quarantine. And we anticipate a follow-up Q&A session with the commissioner later this week. So while the school committee didn't have another meeting scheduled, this information just came out on Friday. We had a school committee meeting this past Monday, and we don't have another one scheduled actually until after school starts. So given that, we will be scheduling an additional meeting 1 week prior to the start of school, sometime the week of the 23rd, to go over the most current conditions in Plymouth, any additional recommendations and guidance that may come our way in the coming weeks, and determine our final protocols for the start of the school year. I think we all agree that it's premature at this time to make a final decision based on how things progressed last August for us. So we really want to make sure that when we send out the final guidance for the start of the school year, it's with the most current data, it's with the most current information that we're receiving from the department, any additional guidance. So we will have a meeting the week of the 23rd, and we will be communicating that out as soon as possible. So that's all I have in terms of my update for now. So as soon as our school committee meeting is scheduled, I will be sure to communicate that. We will be communicating that heavily to the general public. Thank you, Steve.
Thank you, and that's Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools. He'll continue on our panel as we now move to State Representative Matthew Muratore. Matt, what's happening at the state level?
Well, as you know, the rates are actually going up a little bit, but we have to put it in comparison to where we were over a year ago, last March and April. Remember, we have 7 million people here in the Commonwealth. Right now, as Dr. Potvin indicated, we are close to 70% of the population fully vaccinated. Right now, we have 80% of the population in Massachusetts that have the first dose. So if you translate that to another 3 or 4 weeks, by Labor Day, we should have close to 80% of the population in Massachusetts fully vaccinated. So I think that's some good news there. 8.9 million vaccination doses have been administered since day one, 4.6 million first shots, 4.1 million second shots of Moderna and Pfizer, and almost 290,000 of the J&J. One thing I do want to add to, and I'm not sure Dr. Potvin got that, but the Board of Selectmen late last night issued a mask mandate for all public buildings. So if you're going to the Center for Active Living, or if you're going to the town hall or other public buildings, you will be required to wear a mask at this point. Also, I want to just indicate it too, that with the vaccine, for the most part, it's foolproof. It is foolproof. However, with that said, the state is now keeping track of numbers of people that have been vaccinated, but that have been hospitalized after getting the vaccination. And right now, out of the almost 4.4 million people that have been fully vaccinated, less than 400 people have been hospitalized, and 100 people of those have died, unfortunately. So it's a very, very small percentage of those, and almost 7,700 of those have confirmed cases of COVID. So again, with the cases going up, we are still seeing vaccinations going up as well. So I think that's some good news. With the 883 new cases that came on yesterday and 2 new deaths, the last time we saw 883 new cases of COVID was back on May 6th. There are the total COVID cases since a year ago, March, are 675,425. As Dr. Potvin indicated, we're close to 18,000 deaths at this point. The death rate has slowed down significantly, though, over the last several months. So that's just showing that the vaccination is working. And again, most of the cases that we're seeing now of people that are getting the COVID and hospitalized are really those that are unvaccinated at this point. The hospitalizations still remain relatively low, even though rates are going up. There's 226 folks in the hospital in the Commonwealth right now with COVID-19 symptoms, and 51 of those are, 16 of those are on in intensive care. So it's a very small population, and those numbers really are not changing all that much at this point. So that's the update from the state level, Steve. And I want to thank you again for starting up these shows. I think the timing is perfect to be doing this. It'd be good to hear from Chris Campbell later on in the month once the school committee decides what they're going to do, because I'm sure there's going to be. Sorry, did you get the last part of that?
Yes, thank you, Matt.
Okay, thanks.
We lost you. And that's State Representative Matthew Muratore. And with just a few minutes left, we're going to go back to each members of the panel. They've had a chance to hear each other. And I do have a couple of questions for Dr. Barry Potvin. Barry, we heard that Plymouth County is a substantial risk or a substantial zone, and we also heard about the face mask advisory. I noticed that health clubs and fitness centers were not in your list of public places on the mask advisory. And at my fitness center, I know that some people, but not most, are wearing masks. And so I'm wondering whether or not the Board of Health has considered extending it to other businesses. And finally, how are you distributing this information? Much of the information that you're providing us today is not information that I've previously received in another format. And I'm just wondering, what can we do to help further distribute it?
Okay, well, the health club that I attend also is in the same situation. A lot of people there are not wearing masks any longer. And so, although that list of various locations where you need to mask was just examples, it was not by any means a full and complete list. Certainly health clubs should be included in that list. In terms of disseminating the information, this can be posted if there's time to do it quickly on the Department of Public Health website, all the slides, and of course it will also be available on the PAC TV recording that you're currently seeing. And I should also just add a couple of other pieces of information. Good news is that what Provincetown has done has been effective. And so Provincetown now states that the measures they have taken have gotten the outbreak that they've been experiencing under control. So that's worth mentioning. And I was just also informed that something new came out, maybe Matt knows about this, concerning nursing home staff. Apparently there's been a decision made that all staff at nursing homes, long-term care facilities, and veterans homes should or must be fully vaccinated no later than October 10th. And that was just something I was just hinted at by someone who I happen to live with, who gave me the heads up about it. So, you know, I just want to make sure that everyone knows that we have ways to deal with this. Of course, we need more people to get vaccinated as quickly as you possibly can to protect everyone. Your vaccination decision does have major consequences, not only for yourself, but for everyone you live with and come in contact with. So we all have a social responsibility to do this. And wearing face masks was previously shown to be very effective before we even had a vaccine. So I hope everyone will cooperate. And maybe within a few weeks, by the end of the August shows, we'll have this back under control again. Thanks, Steve.
Thank you, Dr. Barry Potvin. Quickly, Dr. Christopher Campbell, we have another minute for you. Any closing thoughts?
Yeah, just to reiterate that we will continue to communicate throughout the month and especially in the final week before school starts. But I would just reinforce what Dr. Potvin said, that, you know, while it's certainly a personal decision, just encourage anyone who's eligible to, if they have concerns, consult with your PCP, but vaccinations are helping us considerably to fight against this virus. And, you know, the governor noted recently that we have one of the highest vaccination rates in the country. There's more than 900 vaccination sites available across the state, and, you know, most of them accept walk-in appointments. I just encourage people. We continue to urge all school personnel to get vaccinated to protect themselves, their families, our school community, and we really appreciate the assistance to keep all of our students, faculty, staff, our volunteers safe and healthy. And as always, health and safety remains our top priority, and educating children in person without interruption continues to be our goal. So I really think that this is the way that we can do that, by really just getting those vaccination rates up as much as possible.
Thank you, Dr. Christopher Campbell. State Representative Matthew Muratore, another minute.
Yeah, so I reiterate what Chris had just said too about the vaccinations. Absolutely, if you can get it, consult your primary care. I was actually just going to announce about the long-term care facilities as well, but Barry took my thunder as usual. But the reason why that's happening is, out of the 380 something nursing homes, half of those nursing homes have less than 75% of the staff actually vaccinated. So I think that's why he's taking this drastic measure at this point. So good thing we're doing these updates again. I think we're going to see more and more changes coming up over the next several weeks. So thanks very much, Steve.
Thank you. And that's State Representative Matthew Muratore, who was joined by Dr. Christopher Campbell, Dr. Barry Potvin. And this concludes today's presentation. Again, we'll be back next Wednesday and every Wednesday in the month of August at 12 noon, live on PAC TV. For this particular presentation, you can look, if you just joined us, you can go back to pactv.org and click onto the TV schedule, pactv.org/Plymouth, and that will bring up the full schedule. Again, my name is Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and please continue with us throughout the month of August. Good day.